Hello, everyone. Thank you so much for joining us for our Invaluable um, webinar series. Today, we're going to talk about how to start working while keeping those benefits. My name is Kaylin Hessel. I am the Advocacy and Outreach Manager for the Oregon Able Savings Plan. And with me, I have Josh Goller, who works with the Work Incentive Network, or WIN Network. And he is just an expert in all of things work benefits, trying to get those to go together. So thank you so much for joining us, Josh.
Of course, Caitlin, thanks so much.
Yeah. So first off, like, what is so great about work? Why should people want to have jobs to work?
Sure. Well, first off, just want to talk a little bit about what one of the main reasons someone would work would just simply be because they need money. Unfortunately, benefits are structured in a way that it's really meant to keep people housed and fed, but not really much beyond that. There's not, it's meant for survival, surviving, but not thriving. And so in order for people to reach their financial goals or their personal goals in their life, they often would need some supplemental income. And so one of the reasons why benefits are not quite enough is simply because of the dollar figures involved. So if you're on SSI benefits, which is supplemental security income, it's mostly for folks who haven't worked a lot in their life and receive benefits. That benefit rate is only 794 for an individual, which is actually only 3/4 of the federal poverty level. So very low amount of money. And again, just really for food and housing, and of course with housing prices the way they are, not even really that in a lot of cases. With SSDI, which is a Social Security Disability Insurance, it's for folks who have worked and became disabled and can draw benefits because of that, or they're drawing benefits from a parent or even a deceased spouse's work record. Those folks, they get different amounts of benefits depending on how much work has been on that record, but the average is about $1,277, which is just barely over the federal poverty level. So really not a way for people to get ahead. And as you see in the top bullet point here, the poverty rate for folks with disabilities who are working age is actually over twice what it would be for folks without disabilities. That's 6 million beneficiaries that are at the below the federal poverty level. So that's a problem. And so work is a solution to that problem in a lot of cases because it can help folks supplement that income. But of course, that adds a whole list of other problems and anxieties around what's going to happen with my benefits because a lot of folks had a lot of struggle to get on the benefit in the first place. Maybe it took a long time, there's a lot of paperwork to fill out, or there's just a lot of confusing rules that and misinformation that folks are getting about their benefits. And so it's not so simple as to just, I'm going to go to work. It's, I need to know what's going to happen when I go to work. And so that's kind of why an organization like WIN exists and other benefits planning agencies, and just benefits planning in general, is to help folks understand, okay, when I go to work, this is what's going to happen with my benefits. This is what I can keep. If I don't have this benefit anymore, can I get it back? And then just plan ahead for their finances accordingly, so there aren't any nasty surprises along the way.
So knowing how complicated it is to, get those benefits and navigate them, I mean, is it worth it for people to start trying to get jobs? Like, always, sometimes, depends.
Yeah, in most cases, it's almost always going to be financially advantageous for people to get employment. So
Okay.
Social Security structures the rules in a way that it really does incentivize work. Um, as an organization, they understand that if there are all these hurdles for folks to clear in order just to get a job and be financially better off, most people aren't going to go back to work because of those obstacles. And so Social Security tries to make it incentivized as far as you're going to be better off at the end of the month with your finances by working in pretty much every scenario. You're also going to be able to either keep a benefit or get it back if you need it. Um, and there's also other financial advantages to employment as well beyond just what Social Security offers. There's things like the fact that you're paying into the system. You're paying FICA taxes, which are payroll taxes from your wages that pays into the Social Security system, which eventually can lead to additional benefits for yourself, whether that's retirement one day, or maybe you qualify for something like an SSDI benefit that you didn't qualify for before. So that's a financial advantage as well, in addition to the biggest one, simply just being more money in your pocket or your bank account at the end of the month. But
Sure.
then
And don't both of those SSDI and traditional Social Security retirement benefits pay more than SSI does?
exactly. So if you're on SSI only, it's because you haven't worked much. And so if you are able to then go to uh, get a job and work for a while, you may be able to qualify for SSDI and get a higher benefit if you need it in the future, and then definitely retirement one day as well. So yeah, that's another financial advantage outside of just the paycheck. For sure. And then there's also other aspects to consider. The social aspect of employment. I mean, it's a chance to engage with your community and interact with people. You meet a lot of, people meet a lot of friends through their employment and that sort of thing. And then also personal advantages as well, with just achieving lifelong goals, a sense of accomplishment of a job well done, and also depending on what type of work it is, there's a lot of satisfaction to be had in just helping others in that job. Um, and so those things really need to be taken into account too. It can really help someone's sense of well-being outside of just the financial stuff, even though we focus with WIN and benefits planning mostly on the finances. So then a natural question that would come up, of course, is how is work going to affect my benefits? And so that's really the biggest thing that we deal with in benefits planning. It's why people come to us in the first place. They just need to know what's going to happen. So I'm going to go into some details about how that works with SSI and SSDI benefits, keeping it pretty broad because of time constraints, but just to give you an overview. So a Title II benefit, that's SSDI or even a retirement benefit like we talked about before. But here we're talking about disability benefits. So we're going to be talking mostly about SSDI, but I also will call it Title II because sometimes folks can draw from a different type of benefit from a parent or a deceased spouse. And it all kind of falls under the same umbrella. But for this type of benefit, folks will essentially, the short answer is how much you can work and keep benefits long term is if you're not working over what's called substantial gainful activity or SGA, you're not going to lose your cash payment. There's more to it than that, but that's the very, very short answer. And that amount is $1,310 of countable income in 2021, and that's per month. If you happen to have blindness as your disability on record, and Social Security meets Social Security's definition of blindness, it's actually $2,190 is SGA, so even much higher.
Yeah. Do you
And
know why there is that higher SGA for people with blindness?
not exactly, other than there are just a handful of different rules for blindness, and it's just been treated historically been treated as a different kind of in a different category in certain things, and everything gets passed by Congress, and so at some point it might have just been advocacy on behalf of folks with blindness that allowed for a different set of rules.
Sure. And so if those rules got passed at different times,
Hmm.
that might be why they might not match up.
Exactly.
Interesting.
Yeah. And so that's just the countable income is above that number is when you'd have to worry about a benefit not being paid. There are ways to reduce your countable income. So those numbers are not how much can I earn total. You may be able to earn much, much more than that and still be considered under SGA. It just depends on your circumstances. And through benefits planning, we can help identify some of those work incentives that can reduce the countable income for folks. So those aren't hard and fast numbers, but it is kind of a jumping off point. Social Security, if they see wages in those amounts, will say, okay, we need to look at this and decide if this is substantial gainful activity or not. This is SGA. But also with Title II benefits like SSDI, there's a thing called a trial work period that everyone gets where they don't even consider SGA during that time. You actually get to earn an unlimited amount during the trial work period. Folks get 9 trial work period months in order to kind of figure out how much they can work, and it could be even be full-time work, and they're still guaranteed their SSDI payments. So that's a very helpful incentive for a lot of people who maybe want to try work, very substantial work, but just aren't sure what's going to happen with their benefit or happen with their ability to do the job even, and don't want to lose a benefit and not be able to get it back. Trial work period really allows people to not even forego that payment during that period of time.
Sure, that sounds really helpful. I mean, a lot of jobs have like a 6 month trial period so that they're trying to
Mhm.
figure out, are you a good employee for us? Are we a good fit for you? So it's nice to know that, Social Security gives you 9 months so that you can at least get through that period too while you're figuring it all out.
Exactly, and I may have this on a future slide, but the trial work period also, it's not necessarily 9 consecutive months. It's 9 months of earning over a certain amount. So if you're very part-time, you might not even be using up your trial work months, those 9 months. You may have them in the future. The amount that they look at is if it's over $940 in a month, then that's when they'll count that as a trial work month. So if someone goes back to work and they're only making $500 a month or something low like that, they actually aren't even using trial work. They have it there in the future for future use. So that's a really helpful thing for folks too. It's not just that you only have 9 months to try this out. It's depending on how much you're earning, really. And then even when cash benefits may stop, if someone is working over this SGA figure, there are other rules that allow the payments to resume or be reinstated if then work drops back below those levels. So it's not something where you work over SGA and that's it for your SSDI. Most cases it'll just resume once the work drops below those levels, or maybe has to be more formally reinstated, but it's a much simpler process than ever having to reapply, which is kind of where a lot of the anxiety for folks comes from, is that application process, which could be very difficult and time consuming. Once you're on the benefit, you really don't have to worry about doing that again in most cases, even if you don't have the benefit anymore.
Oh, that's great. Okay, so let's say you have a job for like 5 years, things are going great, but then you don't have the job anymore. There's no time limit. You can still get on to SSDI more easily than the first time.
There is sort of a time limit, but it is a very generous one. So if
Okay.
you terminate from the benefit, and that's if you use up your trial work period, and then there's actually another 3-year period where you can't lose the benefit entirely. But once those are over, if you do terminate the benefit because you worked over these SGA levels, then you get 5 years. It's interesting you brought up the 5-year number because that's exactly how much time they will give you to then get back on the benefit through a process called expedited reinstatement. So if you could intentionally work your way off of benefits because you have this great job, you're better off with the job than you were with just being on benefits and working part-time. But then yeah, you lose the job because of something crazy like a pandemic or something like that, layoffs and things like that, or you just don't like it anymore and want to move into something else that maybe doesn't pay as much. Social Security doesn't look at why you aren't working at that level anymore. They just look at how much are you earning. And if you're below SGA within that 5-year period, you can be reinstated on your benefits. So it's a pretty generous amount of time where you'd have to be working for many years at a high level before you'd really have to worry about reapplying for the benefit. So this goes into a little more detail on this slide. I already mentioned some of it, so we'll kind of gloss over a little bit. But 940 a month is really that trigger point where a trial work period month is used. So less than that, and you're not even using a trial work month. But no matter how much you earn, it could be $1 million in a month, you still get your SSDI during your trial work period. There are other work incentives with SSDI that aren't quite as automatic. Trial work period just kind of kicks in automatically. Other things you have to apply for. And so one of those would be an impairment related work expense. And it's kind of in the title is kind of what this is. It's a work expense that is related to an impairment and it has to be paid for out of pocket by the individual. So an example would be if I have medication copays or I have to pay for a pair of eyeglasses or something like that, which is necessary for me to work. Can't work without my eyeglasses, can't work without my medications. Then that amount that I paid for that expense could be deducted from my countable income. So before, when we were talking about that 1310 not being just your gross wages, if I happen to make $1,400 in a month, that's over the 1310. It looks like I made SGA, but then I have $100 worth of expenses that I can apply as an impairment related work expense. It will reduce my countable income by that $100, bringing me back below SGA. So that can be really helpful for folks who have especially costly medical care that they have to pay for out of pocket. And this also doesn't have to be related to the disability on record. So my disability might be mental health related, but if I have the eyeglass example, something with my eyesight where I need that in order to work, it's not a disability of record, but it's an impairment, and so I can still claim that expense. So it's really helpful for folks to keep their SSDI cash payments even if they happen to be working over that $1,310 in a month.
That's really interesting. How broad is their definition of work expense? Like what you were saying with the medication, yeah, you need those to work, but also just to live for a lot of the
Right.
medications that are out there, it's not exactly specifically work related. Um, so like how generous are they with that?
It is kind of a gray area where sometimes you might not be sure if it's going to be something they'll approve or not. We always just apply for those anyway and see if they will get approved. But generally, as long as you can just point out, well, I need this to work. So things like vitamins or something like that maybe wouldn't count because do you need your vitamin C in order to work? Maybe not. But anything that's has anything to do with function will most likely be approved, and especially if it's something that's prescribed by a doctor, which is another reason why maybe vitamins or something like that wouldn't count versus a prescribed medication that you definitely need would count. One thing that gets a little hazy is when it comes to transportation. Sometimes transportation costs will count, but if you live in a metropolitan area, you live in a city that has public transportation, and you're taking a cab service, they may just say, well, you could have taken the bus. We're not going to approve that. So it's kind of that's where it's more of a gray area. Whereas if you live in a rural area, you can't drive yourself and you have no transportation options outside of hiring a service, then that's more likely to be approved. So sometimes it's very case by case as far as what they will approve.
But it sounds like you should just go ahead and try.
Yeah, I would definitely worth talking to a benefits planner about it at least, and we can provide guidance and yeah, when in doubt, it's worth applying for it because they may approve it. If they don't, the worst case would just be that they say no, and that's okay too. And so some additional work incentives for SSDI would include something called a subsidy or special condition. And that is when someone gets extra assistance or extra supervision or extra breaks that are received on the job. There's a way that we can quantify this into a percentage, which can then lead to a dollar figure, and it can reduce those countable wages. And it can be pretty significant. I've seen subsidies that are a 50% subsidy, meaning someone can actually earn twice as much as that 1,310 SGA number and still be considered SGA because half their wages are just deducted or excluded. So this is very case by case too. And this is when an employer provides those extra supports on the job, or maybe someone gets extra supports through something like Voc Rehab provides a job coach or something like that. That helps on the job. Those types of things can actually reduce countable income to get someone under SGA. So if there's ever any extra supports on the job, we want to look at, okay, can we quantify that into a subsidy and apply that as a work incentive? It gets pretty complicated, but the point is just that it's something that if there is any extra assistance on the job, we want to look into that a little further about developing a work incentive possibly. And then finally, for SSDI work incentives, they also just do this is a little more automatic income averaging or unsuccessful work attempt. If someone happens to have count or has wages that are slightly over that 1310 for a non-blind individual, they won't necessarily say that's SGA. If it's only over by a little bit, they'll look at the corresponding or the months that are adjacent to that particular month and decide, okay, we'll average all those months. And if the average is below 1310, then we'll say that's not SGA level work. That doesn't happen in every case. There's certain rules about when it can apply, but it does apply in a lot of cases. And then there's with an unsuccessful work attempt, that's something where someone, if they start a job that's over SGA, but then can't maintain it for up to 6 months because of their disability, that they just can't physically do it anymore or something like that, then Social Security will actually just exclude those months of otherwise SGA work under this provision called an unsuccessful work attempt. So it's another way for someone to try work and maybe not be able to do it and then still be able to keep their benefit. So it's kind of another safety net. Okay, so let's shift gears then for a moment to SSI benefits. Again, supplemental security income, typically for folks who haven't worked a lot in the past and can't draw from their own work record. Total different set of rules. Unfortunately, Social Security likes to make things complicated. So they have one set of rules for one benefit, one set of rules for another. And that's really where some misinformation can come from, because if you're talking to someone about SSI and they have SSDI or vice versa, there's going to be a lot of misinformation and confusion involved. But for someone who is on SSI benefits, unlike the SSDI benefit where and I don't think I mentioned this, you get your full SSDI payment or none of it depending on how much you're earning. For SSI, you get an adjusted payment when you work. So they will reduce payments somewhat when you're working, but they do it in a way where when you add your reduced SSI to your wages, you're always going to be better off with more money in your pocket at the end of the month. Um, and so specifically what SSI does is if you have SSI only, no other benefit like a partial SSDI and SSI, if you have SSI only, they'll exclude the first $85 that you earn and then count half of the rest. So on this slide, I just did a quick, easy math example of if you happen to earn $1,085 in a month, they'll actually only count $500 of that towards your SSI. So $500 will come out of your SSI payment in that scenario. It would be a smaller SSI payment. It'd be $294 is actually what it would end up being. But then if you add that $294 to the $1,085 in wages, that person has over $1,300 at the end of the month. Much better off than the $794 they'd have by just staying on SSI and not working. So that's why they structure it that way, where it's really is incentivized to work. Yes, your SSI goes down, but you're always going to be better off by working. And there's also many work incentives similar to the SSDI side that can be applied to reduce countable income further. And the less countable income there is, the less will come out of the SSI payment. So those incentives just help you keep more of an SSI payment every month. And thankfully, even with SSI, if someone works so much that their payment reduces to $0, which would be about 1,600, I think it's 1,675-ish dollars a month is what the math works out to. If someone works that much and their SSI goes to 0, they still maintain eligibility for SSI, so that they can get those payments again if their income drops. They don't lose SSI eligibility, and they maintain their Medicaid, which is very important for a lot of people, and we'll talk a little bit more about that in a few minutes. But that's a really helpful incentive where people, even if they're not getting a cash payment, are still connected to SSI and connected to Medicaid. And then the other important thing to know with SSI is it's a needs-based benefit. So there are things like a resource limit to consider, where how much money you have in the bank and how much assets you have available to you can impact your eligibility for SSI. For an individual, it's $2,000 a month. And Kaylin, I think you know a thing or two about resource limits working with ABLE. That's one of the programs that exists for folks to stay under resources, even though they can save much more than $2,000 in the appropriate account. Another thing that can do that is a special needs trust. And then there are other programs that can help folks save for certain employment or education goals, like a PASS or an IDA, which is an individual development account. And those are special programs that the money that's being saved towards those employment or education goals can be excluded from resources as well. So, and also you can own a house and you can own one vehicle, and those things are excluded from resources. So there's a strict resource limit, but there are some ways around it, thankfully, and some exceptions.
Yeah. So I'd like to jump in for just a
Yeah.
quick second, Josh. So yeah, it's great that, you can start working and then hopefully you'll be able to start saving and then you hit that resource limit. So it is potentially a future problem that people can run into if they haven't, had that being an issue before. So with an ABLE account, people can save up to $15,000 a year, which is definitely more than I can save. So pretty decent. But if someone is working, they can actually save more than that. So there's a new part of it called Able to Work. So it's a little complicated. They can either save an extra, I think it's currently $12,760, or the total of their wages, whichever's less. So if someone makes $5,000 a year, they can save an extra $5,000, and that would be $20,000 total. But if they're making like $30,000 a year, then they're stuck at that $12,760 limit. You can add that to the $15,000, and then it's $27,260. So we also have, an incentive to help people work and be able to save more money. In order to qualify for that, someone needs an ABLE account, and then not be saving for retirement somewhere else, basically.
Yeah, thank you for that. That's before ABLE. I've been around long enough that I remember the pre-ABLE days in the early 2010s, and Yeah, I mean, back then all you could really do was spend. We were often advising folks to spend down in a lot of situations, which, if you receive some money from an inheritance or a settlement or whatever the case may be, and then you have someone who's giving you the financial advice to just go out and spend all that money, it felt a little weird actually to advise people that way, but sometimes it was necessary because the benefits they received, especially through Medicaid, were so important. So thankfully, Able is here now to prevent that situation in a lot of cases, and allow people to save and put money aside and not have it affect their resource limit for SSI and for Medicaid. So it's a very, very, very helpful program. I'm glad you guys are around.
Yeah, me too. And people can even save for job related expenses, and stuff like transportation. So if transportation wouldn't count as one of those other expenses we talked about earlier, it's possible that you could save up and pay for that out of pocket with your Able account. So it can help you continue to work, or maybe even be able to get a better job one day, because you have some savings, and so you're not as concerned about having those benefits decrease.
Yeah, and it also seems like it's an easy way for folks to access their money as well. It's not something where it's tied up in this account that's very difficult to get those funds if you need them. And that's another huge advantage, I think, of Able.
Absolutely.
Okay, so moving on to some additional work incentives that are SSI related. So there is something called the student earned income exclusion, which is a really great incentive for anyone who's under the age of 22 and regularly attending school. And the definition of regularly attending, Social Security has that outlined depending on if it's high school or college or a transition program or whatever the case may be. But most of what anyone would consider to be regularly attending school is going to qualify. You do have to be under age 22, so it's not open to every student. But what happens with the student earned income exclusion is that they will exclude up to $1,930 a month in wages from that SSI calculation. So when I was talking about if someone made 1,085, 500 of that is going to count towards a reduction in SSI. That won't happen with the student earned income exclusion. If you can apply this incentive, up to $1,930 is excluded, which means you get your full SSI payment in addition to up to $1,930 in wages. So essentially, most students who have this incentive applied can just keep their full SSI payments while they're working. There is a limit of $7,770 a year. Once it gets to that limit, they won't let you exclude any further. But if you're a student regularly attending school, you're probably working part-time and you may not even get to that amount. So it's usually not too much of a burden to stay under that amount. So that's a really great incentive. There is also that impairment related work expense that we talked about earlier. That is still something that is an SSI work incentive as well. It just works a little differently. For SSDI, it's to get someone under SGA and keep their payment. For SSI, it also reduces that countable income, but it just allows for more of the SSI payment, more of that money to be back in the SSI payment. It ends up being about half of the value of those expenses you'll get back in your SSI payment, just based on how the formula works for how they calculate these things. So if you spend $100 on medications, you'll get about $50 back in your SSI payment as a result. So that can be a helpful way for people to keep more of their SSI payment in addition to their wages. If you happen to be blind, this is another example of a little bit of a difference. There's a thing called a blind work expense where this doesn't even have to be a work expense related to an impairment. This just has to be any work expense. Any sort of work expenses can be deducted from countable income. So that can include things like childcare, not related to disability. Things like if you have to purchase a uniform at work with your own money or something like that, tools that you maybe have to purchase for your job, anything like that. Even things like lunch that you eat on the job can be excluded from your countable income, and it can allow you to get that money back in your SSI payment, and even income taxes that you pay on your wages itself. So it's a very, very generous work incentive. And the way the math works out here is you get 100% of the value back in your SSI payment. So if you paid $100 a month for whatever it may be, I was going to say childcare, but I think that would be a lot more than $100 a month. But if you paid $100 in lunch, let's say for the whole month, that can allow you to get that $100 back in your SSI payment. So it's the full value. So that's a really great incentive. And then finally, there's something called 1619B. This is that non-payment status I was talking about before. When your SSI goes to zero, you still stay connected to SSI. You're not terminated from it. You just aren't getting a payment because you're making too much money. But it allows you that access to Medicaid and allows you to resume your SSI if your wages decrease.
Is there a time limit for that 1619B?
No, there is an income limit, which I think I listed somewhere else on a future slide. It's over $43,000 a year. So as
Okay.
long as your income is under 43,000 a year, you're going to be able to keep that non-pay status. There is no time limit though. It's just income limit. So you could do this for decades and then, if you lose the job, you'd be back on the SSI payments and you keep your Medicaid the whole time. So that kind of leads into then what if you lose your job? That's the biggest question that a lot of people have. And so not only what will happen when I start working, but okay, what if I lose my job and then do I get everything back? And we've kind of already talked about there's a lot of incentives that kind of keep you from losing anything permanently, at least for many years, And so one of those is if you're on Title II or an SSDI benefit, there's a thing called an extended period of eligibility. And so this is after your trial work period where you can make as much as you want anyway. During this phase, you actually get 3 years where they can't take away your eligibility for the Title II benefit. You just might not get paid if you're over that SGA amount. But it's just a way to preserve someone's eligibility. So even if they're not getting a payment and then they lose their job during this 3-year period, they'll resume their SSDI payments right away because they're not working over SGA anymore. So that's a really helpful incentive. And then also expedited reinstatement, which we kind of touched on earlier with that 5-year safety net. So that's when you actually do terminate from the benefit. You've worked enough that you're terminated either from SSI or SSDI. You get those 5 years from the termination date to go back to Social Security and say, I'm no longer working over that SGA level. I'm applying for reinstatement, and they will reinstate you in a much more streamlined process than applying in the first place. And you can actually have stopped working for any reason. It doesn't have to be because you're of a disability increasing or decreasing your functionality or anything like that. It could just be you quit the job. It doesn't have to be related to disability. And then 1619B, like we just talked about, another way for someone maybe not receiving a cash payment to then resume payments when they lose that job, lose that source of income. And so SSDI also, some folks who have SSI actually, if you happen to have had that reduced benefit rate, your benefit's lower because of work, you lose the job, you're back to the full benefit rate. So that's what folks can expect when they're on SSI and having that reduced benefit rate. And thankfully, most of the time, people are maintaining medical benefits throughout this whole process. And so when they lose a job, the medical benefits are just continuing. It may be that it switches status. You may be in that 1619B status and you switch back to an SSI pay status. And technically behind the scenes, your medical benefits have changed as far as the coding goes, but for practical purposes, it doesn't matter. You've had medical benefits the whole time. So losing a job shouldn't impact you in really any negative way. It's only going to help you get back on the benefits if you need them. So another question then might be, what's going to happen about finding a job? How do I get a job in the first place? And with WIN and with benefits planning in general, we do focus more on once you have a job, what's it going to do to your benefits, rather than helping you find a job. Sometimes people call us thinking we're helping find employment, but that's really more the realm of vocational rehabilitation or other employment networks throughout the state. So if you're interested in finding work, contacting your local voc rehab office is usually a good way to get going with that process. They can connect you to other supports necessary to work. They can help fund certain things, whether that's adaptive equipment necessary to work, and things like that. And really a great way to plan for a future career. Maybe you're working currently in a part-time capacity, but you want to work full-time in a different line of work and you need help with that. That's something voc rehab can help with as well. And for folks who are experiencing blindness, the voc rehab version of that is Oregon Commission for the Blind. It's kind of under the same umbrella, but OCB is a great place to turn to for those same services. And then there's also WorkSource Oregon, where you can receive job prep services, a bunch of training and education resources, and just a lot of resources and tools in order to develop your your career path and what you want to do for work. And this can also include things like self-employment, which kind of gets overlooked sometimes when people think about working. They often are thinking, okay, wage employment, getting a job with an employer, but some people may want to start their own business or pursue self-employment because maybe that's easier for them to maintain. It doesn't, it's something they can do out of the home, which is maybe something that will work with their disability in a lot better ways, or it's just something where they're more interested in that kind of line of work. Self-employment can be a little trickier, and so in order to really develop things like a business plan and other things that might be necessary to get that off the ground, these services can also help with those types of things. And the benefits programs for self-employment are slightly different as well. So someone would probably want to talk to a benefits planner if self-employment is a consideration, just to learn about the ins and outs of that, navigating that, because it can be slightly different and a little bit more complicated.
Sure. I just want to point out to people that both Voc Rehab, I think, has offices in every county. There is a Voc Rehab office or a WorkSource Oregon somewhere near you. I don't know if WorkSource is every county, but they get pretty close. And then the Commission for the Blind is more regional, but there is somebody that is going to be more local who can help you with these things.
Yeah, that's a great point. Um, and yeah, just finding that it's as simple as going online and looking up the office in your area. The Rehab website has a office locator where you can type in your zip code and it'll give you the address and phone number and everything of your local office. Okay. I also wanted to touch on just Medicaid itself is often a very big concern for folks because outside of just the medical benefits that it provides, which can sometimes be more substantial than even Medicare, it covers things like dental and vision, which aren't always covered by Medicare. So those are important on their own, but Medicaid also funds a ton of different services and supports that people may receive. If someone is connected to a brokerage for development or developmental disability services, those are programs funded through Medicaid that if you lose your Medicaid, you're not going to have access to that. You may have housing that is tied to your Medicaid status and things like that as well. So sometimes Medicaid is really the most important thing to maintain. People don't care about the cash benefit. I don't care if I lose my SSI because I have this great job, but I can't lose my Medicaid. And that might be because you don't have, I mean, it might be the medical portion. Maybe you don't have any other option. Your employer doesn't provide you with health coverage, but oftentimes it's these supports that are paid for through Medicaid. So thankfully, Medicaid is fairly difficult to lose unless you're working at a very high full-time level. There is that 1619B provision, which we've already talked about, where if your SSI goes to zero, you still get Medicaid. That limits 43,116 a year. So you'd have to be working full time at a little over $20 an hour before you'd have to worry about exceeding that limit. If you did exceed that limit, then we'll talk about EPD in a moment here, the third bullet point as an option. But there's also something called the 300% rule, whereas if you're on SSDI, in some situations you can access this other eligibility group, which actually allows you to earn over almost $2,400 a month and keep your benefit under that provision. There can be a cost share associated with that, so sometimes it's not the most advantageous. There are other Medicaid eligibility groups also that are free that I haven't included here. I'm focusing on the highest income limit on these three points. But for anyone who maybe loses their eligibility for all other Medicaid groups because of exceeding income limits or whatever the case may be, if you're on 1619B, you make more than that 43,000, you can buy into Medicaid through a program called the Employed Persons with Disabilities Program, or EPD. And that amount is over $65,000 a year, almost $5,500 a month, that someone would be working and maintain access to Medicaid by buying into the program. And so the way that this works is there's a kind of a structure of 0, 50, 100, or $150 that someone must pay each month, depending on how much their income is, for a participant fee. But that's a pretty low participant fee amount because it will cover everything, basically. You won't have copays. It can even help pay your Medicare Part B premium if you happen to have Medicare, and otherwise would have to pay a premium for that. So it's a very a very good program for folks to maintain Medicaid and keep their medical costs down for a very affordable amount. Most people fall in the $100 category for a participant fee, but if you're higher income, you would maybe have to pay 150. Other cool things about EPD is that it doesn't count a spouse's income, doesn't affect your eligibility at all, or a spouse's resources. So if someone you're married to has a lot of money or has a very high earning job, that will not affect eligibility for EPD, whereas other eligibility groups it very well might. You do have to be employed in order to access this one. That's employed persons with disabilities. It is for folks who are employed. That's when you're applying for the benefit. If you do lose your job, you have up to 12 months to get a new one before they would no longer allow you access to the EPD program. So it's not a matter of, oh, I lost my job, I lost my EPD. You have a whole year to figure something else out. And it can be any level of employment. It doesn't have to be, a certain number of hours or a certain amount of money made every month. You only need to establish, hey, I'm working, maybe it's even just 1 day a month. I worked with someone who had a job doing some filing and they did it once a month specifically to stay on EPD. And that's sufficient. You don't need a certain limit, a low limit of how much you can earn, just establishing any sort of employment. But yeah, this is a great way for folks to maintain access to those services and even just to the medical coverage itself when they're working and wouldn't otherwise qualify for other Medicaid groups.
This is so interesting. You said that you can make up to about $65,000 and still get Medicaid through this program.
Mhm.
And like, that's a really good, solid middle class job. I think a lot of people assume that if you have a disability, you have to, work more of an entry level job, make
Mhm.
minimum wage. But this helps, people to be able to dream those big dreams that they have for themselves. And continue to get all of the supports they need. That's really great.
It really is, and it's because yeah, that's 65,000 a year. That's a little over $30 an hour, so that's a very substantial wage, um, full-time wage, and still maintain access to it. And it's a kind of a lesser known program in Oregon. I should also mention this is not a national program. A lot of other states do have similar programs, but every state kind of has their own discretion as to whether they want to have a buy-in program for Medicaid. And so this, if you move out of state, you may not have access to the same program. Most of the other things we were talking about are federal benefits. EPD is actually a state benefit. So I do want to throw that in there. But also, just having such a high income limit is helpful. But it even has things like a higher resource limit, where most other Medicaid has $2,000 as the resource limit. EPD actually allows $5,000, and folks can stay under that resource limit. So if you can't access an ABLE account or any other means to put money aside and not have it count towards resource limits, you are at least allowed a little bit more than that otherwise strict $2,000 resource limit. And EPD also allows you to have retirement accounts and things like that, and they will exclude those from the resource limit. Most other Medicaid groups, if you have a 401k or an IRA, any sort of retirement account, that's going to count against you, but not for EPD purposes. So a lot of flexibility with it. It's a really great program, but it is a little lesser known in Oregon. There's less than 2,000 people in the whole state who are actually on EPD. So if you ever happen to call your local APD office in order to qualify to ask about this program, you may encounter a little bit of them not knowing what this is. That's happened a few times. Be persistent, because this is a program that's really helpful to a lot of people. It's just that it's a small enough program that sometimes it's not the first thing that comes to mind when people think about Medicaid. Always worth mentioning that point. So to wrap things up, then, what if you need benefits planning and need a little bit more one-on-one, not just a presentation such as this, or there's one-day trainings or things like that that people attend to get this information in a lot more detail. Benefits planning, though, is structured to provide one-on-one support. And so the WIN program, we have 11 benefits planners who are situated in centers for independent living around the state. We cover the entire state of Oregon. In especially these last 16 months or so, it's been remote services, so you can receive services literally anywhere. If you need a face-to-face service, we do have people spread out throughout the state, and usually able to provide face-to-face in a lot of situations under normal circumstances as well. But benefits planning, what it involves, it's really a layered service. So you can start with something as simple as, I just need some basic information like what we've been talking about here. I just need some general information. I don't need a really in-depth look at my benefits. I just need some quick answers so I can feel confident looking for a job and knowing I'm not going to lose everything. So that's something we call information and referral. It's just kind of a broad amount of service where you're just answering some questions, not really digging into the nitty gritty of the details. But a deeper level would be analysis and advisement, where we actually will take someone's benefit situation, what their work goal is, and apply that to their specific benefit situation. So we'll verify benefits with Social Security in the state to know for sure exactly what benefits they have. We'll look at, okay, you want to work 20 hours a week at $15 an hour. This is what you can expect will happen if you're going to be over any income limits, if you need to apply any work incentives, things like that. We also provide what's called a benefit summary and analysis, which is a written report that kind of outlines everything in a lot of detail. And your situation may also involve the need for some assistance with getting those work incentives that we talked about earlier applied. You may need them implemented. And so benefits planners can help with that process, where that may just be guiding you to make sure you get the documentation you need to submit a work incentive request, or even kind of advocate on your behalf if there's any issues, if they're not processing it correctly, or if something with their own work rules isn't being followed appropriately. A benefits planner can kind of step in and talk it over with Social Security or the state on someone's behalf, and kind of explain the situation maybe in a little bit better detail than it's possible to do as an individual who doesn't do this day in and day out for a job. So really a lot of layers of service. We call benefits planning a just-in-time service. So it's really just, we're here to provide you whatever level of service you need or want in the moment. It could be you just want some information and referral right now, but because you're not employed currently, but then in the future you do get that job, now you might need a deeper level of service, and you come back to WIN or another benefits planner for that service. And so that's really all I have for our presentation today. This is a very helpful screen to take a snapshot of, maybe with your phone. If you are interested in any follow-up questions, you can certainly call the WIN help desk. You have to leave a message, and then it's actually myself will call you back to answer those questions for you within a couple of days usually. And so that's a great way to reach out, but you can certainly also email us. You can email the WIN refer email here, which again, actually me replying to those, or you can email me directly. It really doesn't matter. The other program manager of the WIN program is Katie Thompson, and she can be reached at this email. You may want to CC both of us if you're reaching out, but any of those emails or phone number are appropriate ways to get a hold of WIN. And that's just for general questions. You may have just one specific question you want answered, or some general information. Or it could even be, hey, I really think I need a benefits planner. Can I enroll in the program? And we can do that for you as well. But WIN is not the only game in town. There's a lot of benefits planners around, or a good number. And we kind of all collaborate and work together, so we're not in competition or anything like that. Disability Rights Oregon has a program called Plan for Work, which that's their contact information there as well. They also can serve Southwest Washington. So if you happen to move over to Vancouver, for instance, WIN can't help anymore. We're a state program. We can only serve Oregonians. But if you move into Washington, you may be able to receive assistance from Plan for Work. So that's helpful to keep in mind, especially if it's just moving from maybe Portland to Vancouver or something similar. And then there are also some community partners that provide benefits planning, either receiving a certification through the WIN program or other agencies and certifying entities. But there are other benefits planners out there who can serve as well. And there's a list actually on the WIN website of where you can find some of those, often with DD agencies or mental health agencies. But definitely, oh yeah, go for it.
I want to encourage everyone, if you have any questions related to benefits, to reach out to the benefit counselors at, either of these programs. Everyone that I've run into who works for either WIN or, the Plan for Work, some of the most knowledgeable people I've ever met. So they can, I promise you, they can answer your question. And if they can't, they can figure out who can. Like, phenomenal resource that we're super lucky to have here.
Appreciate hearing that. And yeah, we're all kind of, there's so much training that goes into this job, like folks who are hired as benefits planners, it takes them up to 3 months of training before they can even start doing the work, that we are kind of nerdy about how much we like to talk about this stuff because we've gone over it so much. So like it's one of these things where we'll actually get kind of giddy talking about certain incentives, especially if it's something we don't see every day, or there's a work incentive that's kind of rarely used that can maybe apply to your situation. We'll be really excited to talk to you about this because this is our our bread and butter. We do this day in and day out, and so it's a lot of people. This is complicated, and it's something you maybe don't not a lot of fun to talk about, but we'll be excited to talk to you about this. So reach out with any questions at any point.
Okay, great. Josh, is that it?
Yeah,
Okay, that's what I thought. Well, you've answered all of the questions I could possibly come up with and so much more. I've learned a ton. Thank you so much for coming and joining us and talking about all of this with us today. Really appreciate it. For those who are watching online, we will have more of these invaluable sessions. So keep checking out our YouTube page. We'll add a new one about once a month. All right. Thank you so much, Josh.
yeah. Thanks everybody.